Hello everyone, welcome back to my channel. So in today's topic, I'll be telling you the cause of period poop and also how you can remedy that or what you can do to reduce the cause. So if this is your first time watching me, please kindly like, subscribe, and don't forget to turn on your notification bell. My name is Nay Yvonne, and today I'll be giving you the briefing of what you can do in order to reduce this period poop, or maybe the kind of things you would do to limit them. So stay tuned and keep watching. Welcome everyone. So like in today's video, like I already mentioned, I will be focusing on period poop. Yes, many people, they tend to experience this and they are worried. Why is it that during this period they have to be running to the washroom back and forth just like that, or what is actually happening with them? Because for some people, they will not be experiencing the symptoms, so it kind of make people so worried. First of all, you have been dealing with breast tenderness, nauseous, you are feeling very tired, and you are definitely bleeding at the same time, and then during that period again you start having maybe cramps, pain, and that notwithstanding again you start having period poop. That is just a lot for one person to take. I think they need to be giving us a public holiday for having all of these kind of symptoms bundled up together for one person to experience. So in this today video, we'll be talking about it, and we'll also be seeing some measures that we can take in order to reduce some of these symptoms or even prevent it totally. So the first thing I'll be saying about this period poop is that, you know, when you are not seeing your period, your poop is usually normal. It's a little bit solid. You don't have like running stomach or watery poop. But as soon as you start approaching your period, or as soon as your period starts flowing, you start having this desire to go to the washroom a lot and pass out poop, which is usually also very watery. The cause of this is as a result of the fact that when your period is about approaching, your body is stimulated. There is a hormone that is being produced, which is known as prostaglandin. So this hormone now, it's produced from your uterus. The function of this hormone is to cause constriction of the wall of your uterus. So when the wall of your uterus is being constricted, they will shed out and flow now as your menstrual period. So but during this process, when that prostaglandin is being released, at times it will not just work only on the wall of the uterus, it will also extend its function to the bowels. So once it's been extended now to the bowels will also be forced to constrict, and when they start constricting, that's when you start having running stomach. You run and go to the washroom forth and back, and you keep passing out watery stool. So that is usually as a cause of this hormone, which is known as prostaglandin, and this hormone is usually released like 2 days or a day just before your period starts flowing, because it's the hormone that is going to stimulate your uterus, your womb, to shed out the unwanted lining, since as implantation has not taken place. So it has to come out to prepare again the same process for the next month. So when that happens now, it will constrict the wall of the uterus and in turn move to the bowels, and at times also it also affects your anus. Like it goes and constrict the wall of your anus, like you keep constricting it and releasing just like that, and with that it's also going to affect the food in your bowel. That's why you have to run to the washroom to inconsistently to pass out stool, and which at times also the stool is very watery. So that's just the simple cost of it. So now also I'll be telling you what are the things that you can do to limit this, because for some people this diarrhea is not just like normal diarrhea, it becomes so intense. So what are these things that you can do to limit some of these symptoms or to relieve some of these symptoms? So the first thing you have to do is that you have to mind the kind of food you are eating. So you know definitely that around when your period is starting, you tend to have running stomach. So if you know that it's already time for your period to start, you have to be mindful about the kind of food you are eating. You need to avoid food that are very spicy, things that are very sweeteners, or maybe food that you think are going to cause you stomach upset. Very fatty food, you have to avoid all of those things, because definitely they are going to provoke it or make your diarrhea to be more intensified. So you have to avoid those things. You can go for vegetables, fruit, or food that you think will not cause you stomach upset. The next thing you have to do is that you need to stay hydrated, because definitely when you have running stomach, you will be passing out a lot of watery stool, and during that process also you are going to lose a lot of water. You tend to be so dehydrated during that process. That's why it's always advisable that when you have running stomach, it's always good for you to take a lot of water. You have to take a lot of water in order to stay hydrated, because during that process you are losing a lot of water and you are also becoming dehydrated. So make sure you drink a lot of water in order to stay hydrated. So the third point I'll be telling you that you can help remedy this is to take some anti-diarrhea medication. Yes, taking some anti-diarrhea medication will help also limit this diarrhea process. There are different kind of medication. You can check with your healthcare provider. They are going to prescribe the best medication that will be fit for you. And also there's another brand of medication you can take, like maybe to relieve the pain just before, or maybe to reduce the effect of this hormone which is known as prostaglandin, because the function of this hormone is to constrict your uterus. So if you take like painkiller like ibuprofen a day before your menstrual flow, definitely it might reduce the effect of this hormone which is prostaglandin, making the constriction not to be so intense that will be extended to your bowels. So, and if the constriction is not that harsh or the effect is not extended to your bowels, definitely you will not have a running stomach. So taking medications like painkiller is going to reduce the pain and reduce also the effect of prostaglandin. And the next thing you have to pay notice that if you're someone who likes taking caffeine, you have to limit it, because this caffeine most of the times they contain laxative. You cannot be having running stomach then you go again and take laxative, because you know the function of laxative. The function of laxative is to make your poop to be very watery, to make it to be soft. It helps your poop to be soft, especially when someone is constipated. That's why when you are constipated, they will always refer you to take laxative, so that it can help soften your poop and your poop will pass out. So if you're already having a running stomach, you need to avoid any medication that acts like laxative. That's why you also need to limit your caffeine intake, because most of the times caffeine, they have the component of laxative in it. So limit that will also help reduce your running stomach. Another thing also the doctors will refer to you is some contraceptive pills. Contraceptive pills that will alter your ovulation. So when this is being altered, maybe the effect of the cramp or maybe your running stomach or menstrual diarrhea, it's going to reduce, and definitely you will not be having a watery poop during that period. So those are the things you have to pay note. But if any of these symptoms are so severe and so intense, for example, it's coming with a lot of cramp and maybe your period poop, it's so watery and you are losing a lot of water, you need to go to the doctor so that you can be given correct medication that will help limit this and reduce this. So this usually occurs for some individuals. However, many people out there will not experience this. So if you have always been having this, or it has always been happening to you like this just before your menstrual period, don't be scared. This is a normal process that is occurring in the body. So all of this usually happen just within the period of your menstrual flow. So don't get worked up. These are just normal processes that are occurring in our body. So take time and stay relaxed. If you have been watching up to this moment without liking or subscribing, please kindly do, and make sure you share with others. And if you have any comment, you can drop below. I'm going to answer them. Stay safe and make sure you follow the precautions if you are always having running stomach during your menstrual period or just before your menstrual period. Stay safe and love you all. Ciao.